The word cancer in Latin means crab, and it came to be associated with this particular crustacean when Hippocrates, the famous Greek physician and father of medicine, likened the finger-like projections of a tumor with those of a crab's claws. Now, hearing a diagnosis of cancer, no matter what kind, can be terrifying, but by being more aware of risk factors, watching out for telltale signs surrounding it, and just by being better informed can not only improve survival rates with early detection, but also help remove misconceptions leading to fear and stigma. As Ralph Emerson said, knowledge is the antidote to fear. Hi, I'm Dr. Sharon, clinical dermatologist, and in this video I'd like to share some points about skin cancers that I feel everyone needs to know that can help reevaluate your lifestyle choices and help you be more responsible for your health. Now, these are simple points to look out for, but powerful enough to probably even save a life. So, keep watching. Skin cancers are the most common kind of cancers prevalent globally and probably even climbing up on the list, given that several types aren't even included in national cancer registries to account for accurate reporting. Now, there are two major types of skin cancers, the melanoma and the non-melanoma types. The non-melanoma types are the more common ones, including over 95% of all cases, and in this category there are two major types: the basal cell carcinoma, which affects cells that are found at the bottom of your epidermis, and the squamous cell carcinoma, which affects cells at the top of your epidermis. Now, there are other ones like Merkel cell carcinoma, sebaceous carcinoma, but these are really rare, and both basal cell and squamous cell, they cover over 99% of all non-melanomas. Also, these carcinomas are mostly treatable, with the exception of advanced stages of squamous cell. Then we have melanoma. Now, these affect cells that produce melanin, which give your skin and hair color and also protect you from UV rays. Now, melanomas, though they're a lot less common than the other cancers, they are really fatal. So what are some causes or risk factors for developing skin cancer? Now, the main culprit is, you've guessed it, UV radiation. Now, it was between the 1800s and 1900s when researchers found out that UVR caused deleterious effects in our skin, leading to tumors. And they also found out that melanin had a protective role to play in our skin. Now, what UVR does is that it damages the DNA by mutating it, and it also suppresses the body's immune defense, thus preventing it from detecting any abnormalities and keeping it from repairing the damaged DNA. Now, this happens after chronic exposure to sunlight or when you're a victim of repetitive sunburns. So what happens is the skin is unable to fix the problematic cells with the defective DNA, and this progresses to become cancerous over time. Now, while getting UVR exposure as an adult does have its obvious significance, a more crucial role is played by UVR exposure in childhood. Now, the more time a child spends out in the sun, the more number of sunburns, the more intense episodes of sun exposure, the greater the risk of developing a lifetime potential for skin cancer. The risk is not only if you spend long hours in the sun, but it's just as bad if you spend a short time over and over again. Even those who use sunbeds or tanning beds, even they are at a greater risk of developing skin cancer, particularly squamous cell and basal cell carcinoma. Now, even though its use has declined over the years, it's still quite popular among young adults, and this really must be discouraged considering the risks involved. Now, another risk factor would be related to genetics. Now, mutations in certain genes have been linked with both basal cell and squamous cell carcinoma, and even melanoma has been found to run in families. Then there are certain genes in our DNA which protect us from tumors, and they are known as tumor suppressor genes. Now, sometimes they become mutated or they become inactivated, either from birth or after, and so individuals who possess this defective gene are at a risk of developing cancer too. Then there are various genetic syndromes that exist in which children develop cancers too, and these include xeroderma pigmentosum, epidermolysis bullosa, Bayes syndrome, and several others. Then our next risk factor would be immunosuppression following organ transplantation. Now, this particularly is associated with squamous cell carcinoma. Then other factors include human papillomavirus infection, arsenic exposure, radiotherapy, ultraviolet A therapy with psoralen, then exposure to occupational chemicals like pesticides, tar, then chronic wounds that are not healing, scar tissue. Now, all of these are particularly related to squamous cell carcinoma. Then those who have a fair skin are of the Caucasian ethnicity, who have a lot of freckles, who have blue eyes, green eyes, blonde hair, red hair, who have a large number of moles, like more than 50 in number, are all at a greater risk. Then the antihypertensive drug hydrochlorothiazide, which is a commonly prescribed medication, has also been linked with skin cancer, particularly melanoma and squamous cell carcinoma in non-Asian countries. And this is probably because it increases the sensitivity of the skin to sunlight. So those were several risk factors that you need to keep in mind about skin cancers. Moving on, how do these lesions look like and where do they appear? Now, most of these tumors occur on sun-exposed areas, so face, neck, chest, upper arms, scalp, in men particularly the ears. Then in darker-skinned individuals, odd places like palms and soles, nails are also involved. But really, cancerous lesions can occur just about anywhere, even including the inside of your mouth. So you really need to inspect your bodies, especially if risk factors concern you. While skin cancer is present in different forms as patches or nodules in different shapes and sizes, what you need to watch out for are any scaly red lesions or outward growths that bleed on touch, ulcerate, that are painful, that itch, or basically any new skin lesion that hasn't healed even in a month. Then these lesions may be surrounded by signs of sun damage like sunspots, wrinkling, abnormal skin pigmentation, and increased tiny little blood vessels. Then if you have a recent history of physical trauma to your skin and you notice the wound isn't healing, or if a recent scar tissue has become irritated, then you need to consider these with caution and get them checked out. Then if you recently have any new moles, you need to consider the ABCDE, which is a mnemonic for assessing any suspicion of melanoma. Now the A stands for asymmetry, that is, check if both halves of the mole are similar or not. Then B stands for border irregularity, are the borders even or not? C is for color variation, does the mole have a uniform color or are there multiple hues in it? D is for diameter of more than 6 millimeter. E is for evolution, has the mole changed in shape, size, color with time? If you suspect any of these changes, get them checked out as soon as possible by a dermatologist. Now, there are several skin conditions that may mimic skin cancer. For example, red lesions seen in rosacea, or itchy eczematous lesions, psoriatic lesions, all may mimic squamous cell carcinoma. Then seborrheic keratosis, which are senile warts commonly seen in the elderly, may mimic melanoma. Now, it's better to be overcautious and then be proved wrong rather than the alternative. Now, self-examinations, being aware of the consequences of risky lifestyle practices like the use of tanning beds and taking sun protection measures all greatly help in early detection and even prevention of skin cancer. The choice is yours, and I hope that as we've come to the end of this video that you'll make smarter and better choices when it comes to your health and realize that it's not something you ought to gamble with or take for granted. Do your part in being responsible with what you've been given, and the rest will sort itself out. So thank you so much for watching. I hope this was informative, illuminating, and I'll see you in the next video. No, you'll see me in the next video. Bye.